So first I want to start with a land acknowledgement, acknowledging that I live, work, and play on the ancestral and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations in beautiful Vancouver, British Columbia. And these are my disclosures, including that I've been funded by the Pulmonary Fibrosis Foundation Scholars Program previously, and other disclosures here. So first, I want to talk about the concepts of health equity and environmental justice, because these are concepts that you may not all be familiar with. And I want to do a brief review of what we know about health and environmental inequities in patients with interstitial lung disease. Then we want to cover an approach to advocating for health equity, environmental justice, and environmental health policies to protect vulnerable populations, which includes patients with interstitial lung disease. So what is health equity? So health equity is equitable access to healthcare and the ability to have health within your life, and it is incorporated by three central pillars that are laid out by the Mary Black Foundation here, which include high quality education and employment, safe and supportive neighborhoods, and accessible, affordable, and culturally relevant healthcare. So within the healthcare component, that has multiple factors that we may not consider at first glance, including access to mental health care, to maternal and childhood health support, dental health, screening, prevention, and treatment, and health advocacy is a key aspect there as well. A related but distinct concept is environmental justice, and the United States Environmental Protection Agency defines environmental justice as the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. And so environmental justice over the past number of years has really become a key concept in shaping US environmental, climate, and health policy, especially as we look forward in the future in tackling major issues like climate change. It's essential that we do it in an integrated approach that also considers how these other factors can impair health equity and can lead to worse climate impacts in vulnerable populations. So this is a really important concept to consider whenever we're talking about climate change and health impacts as well. So this is one study that really highlights how environmental injustice impacts people in the United States. So we have here on the x-axis, we're looking at increasing PM2.5 concentration. So that's the fine particles that you inhale deep into your lungs that can influence lung health and disease development. So you can see that as your PM2.5 concentration increases, that this hazard ratio, which is a risk for all-cause death, that risk increases as well. And this is in a general US population. So across the board, that increases. But what they're looking at here with these different lines is people living in different groups of neighborhood-level disadvantage, which is a measure of material and social access to various factors related to the US Census data for access to care, transportation, crowding, poverty, other aspects like that. And they found that the people that live in the most disadvantaged neighborhoods, as shown in the green and the beige lines here, actually bore the greatest burden of PM2.5 associated mortality risk or death risk. Similarly, when they looked in Black versus non-Black populations, they found that Black individuals across the US bore a much higher burden of PM2.5 related mortality. So this just highlights that not only are people that are living in disadvantaged communities experiencing more pollution exposures, but when they do experience pollution exposures, their risk of death related to that is also higher. So that's a concept of environmental injustice. We also see environmental injustice throughout the globe in that people in lower and middle income countries tend to be exposed to much higher levels of pollution as well. And so there's inequitable exposures throughout the world that we see that come to play as well. So the next question is, how do environmental and social inequities impact patients with fibrotic ILD? So we know that inequity can have impacts in patients with fibrotic ILD. One of the first studies that was looking at this was by David Lederer and colleagues in 2006 that was looking at people with IPF on the lung transplant list. And they found that individuals of Hispanic and non-Hispanic Black race or ethnicity were actually more likely to die on lung transplantation lists while awaiting lung transplant in comparison to their white counterparts. So this curve on the right-hand side here is showing that the survival curves for non-Hispanic Black and Hispanic patients are lower than the white patients. So there's a survival difference there. Sese et al. Also showed that individuals of low income have worse survival in patients with IPF. And Gaffney et al. Has shown that patients with IPF who are of low socioeconomic status are also less likely to receive lung transplantation than their higher socioeconomic counterparts. This is work by our colleague, Dr. Deji Adegunsoyi, actually with the PFF registry. And this is looking at race and ethnicity as a factor in terms of age at diagnosis and age at death or lung transplant in patients within the PFF registry. And he found that patients of Black race or ethnicity had about a 10-year earlier age at diagnosis, such that they were typically diagnosed at around 58 years old as compared to white patients, which were diagnosed at around 69 years old on average. And moving on from there, he also found that patients of Black race or ethnicity also tended to die or receive lung transplant at about a 3 or 4 year younger age than their white counterparts, even though the duration that they lived with pulmonary fibrosis was longer. So we see that there's racial and socioeconomic inequities in fibrotic interstitial lung diseases, in pulmonary fibrosis. CarePF, which is the Canadian Registry for Pulmonary Fibrosis, has looked at treatment implications, and they've found that individuals of non-white race were less likely to be placed on treatment than patients of white race or ethnicity. So if you look at this 2-year time frame here, about 75% of non-white patients were started on either antifibrotics or immunosuppressant medications at that 2-year time point, whereas for the white counterparts, it was around 85 to 90%. So there's some treatment implications here as well. And this is some of our work looking at neighborhood disadvantage again, that was done in a US cohort. Go one back. Oh, don't know how to go back. One. There we go. So this is looking at a US cohort of patients in panel A and a Canadian cohort in panel B. And when we're comparing our most disadvantaged group in quartile 4 here, we found that these patients have about a 50% higher risk of death as compared to patients in the least disadvantaged quartile in our US cohort, but that this effect was not seen in the Canadian cohort. So it does raise the question as to whether or not there may be some health systems and access impacts that are disproportionately affecting US patients with pulmonary fibrosis. Further, we've looked at PM2.5 impacts on patients with fibrotic interstitial lung disease, and we found that higher levels of PM2.5 exposure are associated with risk of death or transplant in patients with ILD. And in the US cohorts that we looked at, including University of Pittsburgh Simmons Center, as well as the Pulmonary Fibrosis Foundation Registry, we found that non-white patients were more likely to be exposed to high levels of PM2.5 as compared to their white counterparts, an effect that was not replicated in the Canadian cohort. When we've looked at air pollution impacts in patients with interstitial lung disease, there's been about 24 studies that have done some sort of analysis looking at interstitial lung disease related to air pollution, but only 42% of those studies have considered any socioeconomic factors in that. So we're really missing a huge body of work here in terms of understanding the integration between social and environmental factors that contribute to the development development and progression of interstitial lung disease. And I think it's really critical that we understand that these factors are intricately linked and that we are acting upon that in our research and in our advocacy work. So to summarize, inequity in ILD, we understand that inequity exists among patients with ILD based on race and ethnicity, sex and gender, socioeconomic status and neighborhood level factors, as well as pollution exposures. But we don't understand how race, socioeconomic factors, and environmental exposures interact to influence the risk and development of fibrotic ILDs. So how do we address climate change, health equity, and environmental injustice as a patient and as clinicians and researchers, scientists, as anyone who's here at the Pulmonary Fibrosis Foundation conference? So what I like to think of is an integrated patient, clinician, and healthcare systems approach to addressing these huge issues. And really, I think it's imperative that all of us have a role to play in climate action and in advocating for environmental health equity. So it's important for us as providers to know about how climate change is impacting our patients, to be able to communicate that with our patients, but also to be supporting research into climate change, into health equity, to be able to stand as advocates for policy change. As patients, you are the ones who know and have the lived experiences the most. You are the ones who can really tell your stories and be able to communicate about what it's like to be living through these crises and these periods of time. And I think that having those conversations is essential. Asking your physicians about what you can do as a patient to reduce your risk of air pollution effects, of climate change effects, having those conversations is essential. And I think we need to hold our healthcare systems accountable for promoting activities that reduce their carbon footprint, for promoting health equity within their communities, and for taking actions to really produce and facilitate that integrated approach to tackling these major systemic issues. So as a reminder, as a patient, there's a number of things that you can do. You have elected representatives at local, state, and federal levels. You have a unique perspective that I think is really critical that they hear, and it's very simple for you to talk to elected representatives through various avenues, and I think that that's a really important step that anyone can take. Joining community advocacy groups on the ground in your local communities is important to know about what are the environmental issues that are represented locally and what can you do to take action there. Because I think action is really important for promoting hope and promoting our sense of ability to actually do something about this crisis. You can partner with clinician and health system advocates, so engaging in those conversations with your clinicians I think is important, and asking physicians about how air pollution and climate change affects your disease, as we've talked about already today. And then again, contributing your stories and experiences to these advocacy efforts is a really essential component of that process. As clinicians, there's a lot that we can also do to advocate for health equity, climate action, and environmental justice. It's important for us to listen. We're here to listen to how this is impacting you. I think that that's a central component here that we often forget. We can also talk to our elected representatives. We can join those community advocacy groups with you. And I think that we can serve as content experts while also helping to ensure that our patients and our community members are at the forefront of that discussion, because that's what's really critical here. We can join professional advocacy groups. The PFF is really trying to think about climate change and environmental health as a key component of their mission. And the American Thoracic Society also has that, and they have an environmental health policy committee, which I'm a part of. We advocate for health policies and regulations relating to air pollution and climate change that go to the EPA, to the Supreme Court, to the White House. So there's lots of work that can be done from that standpoint as well. And then it's important for us to initiate those conversations with our patients about air pollution and climate risks and how to mitigate these harms. This is just a photo from the recent ATS conference of a climate rally that we went to advocate for, as physicians, as scientists, how important and imperative it is that health policy and environmental policy be considering the impacts of climate change, and really the fact that climate change is one of the most critical health threats of our generation. And I think that if we take an integrated approach where we partner together, that's, I think, will give us a lot of hope that we can really tackle this crisis. And I'll leave it at that. I'd like to thank so many people, but first and foremost, the patients for being here today. Thank you.
Yeah, so today we're going to talk a little bit about wildfire smoke, and I'm going to discuss the increased incidence of wildfires, describe the different components that are in smoke, discuss what we know about the lung and heart impacts, and also then recommend some strategies that you can do to help mitigate risk. And the good news is that pollution concentrations in general are going down in the United States. This graph shows the principal air components over time. And you can see most of them are under our national air quality standards, with the exception of that green line, that's ozone, and that level has been fairly constant. The other side of this coin is that days like this are becoming increasingly common. This is my hometown of Seattle, and normally I can see the Space Needle and Rainier, and this is a picture from a smoky day this summer where you have very poor air quality. And this map is from NASA satellite imaging from this summer, which shows fire activity in red across the globe. And you can see that every continent has been affected with the exception of Antarctica. So how is climate change leading to increased wildfire smokes? With the rise in temperature, we have decreasing in the snowpack. This leads to drier forests, and also land management practices over time, which have really tried to suppress forest activity, have led to increased fuel for wildfires. And then as people move closer and closer to those boundaries between the forests, we just have more people impacted. And this is from a 2016 article in the Proceedings of National Academy of Sciences, which estimates that about 50% of wildfires are directly due to climate change from human activities. And so I think we can all expect that over the next years, we're going to see an increase in the number of fires, more acreage burned, longer wildfire seasons, and worsening severity. And what's in smoke really depends on a number of factors. The source of what's being burned, what type of vegetation, is there building or synthetic material that affects what's in the plume. And then things like temperature or the flame intensity. If it's a really hot fire, things actually combust quickly and they don't lead to a lot of pollutants, whereas a smoldering flame might have more pollutants. And then there are photochemical activities which cause the production of secondary pollutants like ozone, and then geographic features like mountains and wind speed affect how far that plume will travel. So I think people in the contiguous United States this summer saw very poor air quality from the Canada fires, and that was thousands of miles away. So what's in wildfire smoke? So again, it's the byproducts of combustion. So it's mostly water vapor, carbon dioxide, and carbon monoxide, and methane. But then there's also a host of other pollutants that are hazardous to human health. That's mostly particulate matter, different volatile organic compounds, oxides of nitrogen, hydrocarbons, trace metals, and ozone. And we're really worried about those very small particles, less than 2.5 microns in diameter, that's called fine PM, and also ultrafine particles, which are less than 0.1 microns in diameter. And that's a graph that you can see. These are smaller than bacteria, so we can't see them with our eye. But why we worry about these particles is that they can bypass our normal host defenses and really deposit deep in the lungs, close to the breathing sacs, the alveoli, where we know the pathophysiology of interstitial lung disease occurs. And we think pollution acts by many different mechanisms. It can cause direct damage to the epithelial border. It causes systemic and local inflammation and oxidative stress. And it activates the autonomic nervous system. And these effects work in concert to produce health effects. So who's at risk, really? We can think about people who are closer to smoke, so they have increased vulnerability. These might be people like wildfire fighters who are right next to the flame, or people who have to work outside all day, or communities that are really close to the origin of the flame. But then we also have people who may be more likely to develop health effects, and that's people with interstitial lung disease and other chronic lung diseases, different cardiovascular disease, infants and children, the elderly, pregnant women, people with diabetes, and smokers. So we are really just learning what the health effects of wildfire smoke are, and most of this data is based on short-term exposures, so that's health effects that occur within 1 to 7 days of exposure. And almost everybody will have some type of irritation to their eyes, mouth, and throat with high levels of wildfire smoke, and that may be itchy eyes, headaches, stuffy nose, or cough. And then we also know that smoke can increase the risk of respiratory diseases. So this means increased respiratory symptoms, an increase in infections like flu has been shown, reduced lung function, and also an increased exacerbation of lung diseases. And then there's also some mixed but growing data that there's an increased risk of cardiovascular disease, including increased heart attacks, arrhythmias, heart failure, and strokes. So in particular, what are the risks for people who have interstitial lung diseases? And most of this data, again, because we're really just doing research on wildfire smoke, comes from other sources of ambient air pollution, mostly traffic-related or other fossil fuel combustion. And again, when we think about those short-term exposures, so health effects occurring 1 to 7 days after you get exposed, an increased risk of symptoms, and then an increased risk of ILD exacerbations and hospitalizations. And then more long-term exposures over the course of months to years, that we've seen that pollution can increase the risk of having more severe disease, accelerated lung function decline, and causing an increased risk of death or lung transplant. So what symptoms should you be looking for wildfire smoke? I always tell people to listen to their bodies, and if you don't feel good, that means that you may be having a health effect. But some of the common, more milder symptoms are headache, stinging eyes, runny nose, irritated throat, increased cough, or just the increased mental stress that comes with smoke exposure and being worried about the health impacts. And then more serious symptoms that mean you should go seek care is increased shortness of breath, decreased spirometry, increase in your oxygen requirements, any fevers, chest pains, or palpitations. All right, so now that we've talked about some of the health effects, we're going to talk about how you can get smoke ready. And we're going to talk about each of these things, which is how you should use local air quality forecasts, following guidelines for activity, what you can do to clean your indoor air, and when to use personal protective equipment. And I just want to put a plug in that you should try to buy supplies in advance, because nobody thinks about this until it's smoky outside and then everything's gone. So that many of you may have heard of the Air Quality Index. This is how we, public health agencies, communicate what the air quality is. It's a scale that goes from 0 to 500. 0 is very good air quality, where 500 is very hazardous. 100 is where the national air quality standard is. Where can you find your local AQI? There are many websites. Air Now shows the air quality in terms of the Environmental Protection Agency has some regulatory monitors. So if you enter your zip code, you can find what the air quality index is at your house. That doesn't have as fine spatial resolution, meaning that it may not reflect, what elevation you're at or your local area. So you can also look, there are these purple air monitors, and these are personal monitors that people own. The one thing to keep, there may be many more in your area, the one point to keep in mind is you have to calibrate these personal monitors, so sometimes they aren't as accurate. And then areas that are very affected by wildfire smoke, a lot of states in the Pacific Northwest, for instance, they have smoke blogs. And these contain a lot of good health information, and they also make forecasts of what the smoke exposure is going to be like over the next few days based on weather conditions. So the next thing is, when you know your air quality, follow the activity guidelines. And these are color-coded in terms of what the AQI is. Green, again, is an AQI of 0 to 50. That means the air quality is pretty good, and you can go about your normal activities. For people who have underlying lung diseases or may be sensitive, I tell them to start being concerned on upper levels of yellow or definitely with orange. So orange is the unhealthy for sensitive groups, and that's when you should try to reduce your exposure to air pollution outside. And that means doing less physical activity outside, trying to clean your indoor house, and avoiding any, again, strenuous activities and unnecessary exposure to the outdoor air. And it's really important to note that outdoor air infiltrates inside. So if you want to maintain a clean air inside, you've got to close all the windows and the doors, but also houses are leaky. So we know that older houses in particular, that as much as 65% of the outdoor air pollutants can infiltrate indoors. So that's when we start talking about cleaning indoor air. And really, for cleaning indoor air, I recommend either, if resources will allow, getting a portable air purifier, a HEPA air purifier, and putting it in the room where you spend the most time. So that's usually people's bedrooms. If you have a central HVAC system, you can upgrade your filter, and a MERV filter greater than 13 has excellent capabilities of filtering those small particles. And then there are other ways to make a filter that are a little bit cheaper, and you can buy a box fan and put a MERV filter on it, and that actually works really well, and there are good YouTube tutorials on how you can do this yourself. And I don't have any particular air purifiers that I recommend, but I do want to warn people to avoid ionic air cleaners or ozone-producing cleaners, because they release ozone as a byproduct, and ozone is an air pollutant that causes respiratory irritation. How well do filters work? The answer is excellently. When they're appropriately sized to the room and appropriately powerful, they reduce pollutant levels more than 90%. And then finally, what do you do if you have to go outdoors or do activity outside? We do recommend, if the pollution levels are high, to wear an N95 mask. And I think we've all gotten much more familiar with that over the past 3 years. But again, this has to be a tight-fitting mask that seals against the face, so all air you're breathing in has to be drawn through that filtering face piece. And that N95 contains a filter that removes, again, 95% of those small particulate matters in smoke that we're worried about. I know that this is really challenging with people who have chronic lung disease, because it can be really hard to wear an N95 mask, and it may increase your work of breathing, and for people who have really severe interstitial lung disease, it may actually increase your carbon dioxide levels. And the other thing is that, again, for these masks to be effective, they need to have a really good seal. So if you're wearing supplemental oxygen, there is going to be a little bit of break in the sealing. So it's not going to be as effective, but it will probably still have some effect in reducing your pollution exposure. So I just encourage you, if you have any questions about wearing an N95, to talk about it with your physician. So again, kind of what I hope to have left you with today is a reminder that wildfires and smoke events are increasing in frequency and severity, that wildfire smoke can cause serious health effects, especially for people who have underlying lung disease. And then I'm hoping that you're motivated to get smoke ready. And again, know where you can find your local air quality. Do what you need to reduce personal exposure to smoke. Take steps to clean your indoor air, and wear an N95 if you have to be outside in high smoke events. And then here are some excellent resources that you guys can use that have really good, helpful tips.
Thanks so much for organizing this session and for having me talk about climate change effects on health. These are my financial disclosures. So the agenda for this talk is that we'll review some terminology and hopefully set you up for the later talks to come. Review kind of in general or broadly the ways in which climate change can affect health. And I'll throw in some general considerations for people living with interstitial lung disease. I will preface this by saying I'm not any kind of a climate change or policy expert. I'm a pulmonologist or lung doctor, so I tried to make this a little bit medically relevant to the extent that I could. So the definition of climate change is changes in average weather conditions that persist over multiple decades or longer. And this can include increases or decreases in temperature, shifts in precipitation, and changing risks of certain types of severe weather events. This is an overview of the kind of categorical or types of ways that climate change can impact health. The boxes on the, I guess this is your left, we will not cover in great detail. The types of impacts on health over here I'll cover in a little bit more detail. So air pollution probably has the largest amount of data, especially as it pertains to lung disease. We know that air pollution fluctuations can relate to fluctuations in asthma symptoms as well as cardiovascular disease. There are probably also some impacts on interstitial lung disease, and this will be covered in a lot more detail in the next talk about wildfires and particulate matter pollution. So I'm going to kind of skip over this box for now. Climate change can also impact allergens. So in general, especially in the US, most areas, if anything, are tending to warm up. Warmer average temperatures means more frost-free days. So we're seeing the timing of flowering and pollen initiation shifting and probably expanding. There's also some data that increased carbon dioxide in the atmosphere may actually lead plants to produce more pollen and allergens. And increased rainfall, heat and humidity can also worsen indoor air quality that can facilitate mold and mildew growth. So in terms of allergens, this is just an illustration of one allergen, ragweed, and the change in the number of ragweed season days per year from 1995 through 2011. So the size of the circle and the darker red, or I should say the bigger the circle and the darker red means more days added per year during that time period. So especially in the northern plains, upper Midwest, as well as Canada, we're seeing actually up to 25 or 30 extra ragweed days per year. And ragweed is just one allergen. There are other allergens that have slightly different seasons. So this overall has a big impact on the number of days someone with allergies might experience symptoms. How it relates to ILD, I couldn't find any data indicating the proportion of patients with pulmonary fibrosis or other ILDs have allergies, but up to 30% of the US population has environmental allergies. So presuming that translates to similar data in the ILD population. This has a pretty big impact on patients living with ILD. Symptoms can include runny nose, tickle in the throat, cough, itching eyes. Some of those overlap with symptoms that you might experience with your underlying lung disease. So actions to take if you think you might be experiencing allergy symptoms. Talk about diagnosis and a management plan with your doctor to think about ways that you could minimize symptoms that are related to this problem in our changing climate. Another issue related to interstitial lung disease is the increased risk for indoor and also outdoor mold growth. We think that people exposed to mold at home or work have about a 2 or 3 times higher risk of developing pulmonary fibrosis. So mold is thought to be one of these injurious factors that drives the scarring in some patients who are genetically at risk. So it might be a good idea to think about monitoring your home for issues with water leaks, moisture, humidity, and even looking for active mold growth and trying to keep those areas attended to as best as possible to kind of clean up and facilitate a clean air environment in your home. So extreme heat also has some impacts on health. During heat waves, which are becoming more frequent and severe across a lot of the US, we see an increase in hospital visits for lung symptoms, cardiac events, kidney problems, pregnancy complications. Older adults and people with underlying diseases, as well as children and pregnant women, are at greater risk for experiencing hospitalization and symptoms. And there's probably a positive feedback loop between extreme heat and worse air quality and pollution. This is a graph of extreme heat events in the US. And again, the circle size as well as darker red corresponds with increased risk. And this is projected change in mortality related to extreme heat. So the eastern US is particularly affected by this issue, with some areas projected to see 8, 10, or 12 additional deaths per 100,000 people related to extreme heat. And then one final category that I'll talk about in a little bit more detail are extreme events such as floods, hurricanes, tornadoes. And the biggest issue for people with chronic diseases is disruption of health infrastructure, things like reduced access to pharmacy, hospital, doctor's office, dialysis, as well as disruption of the home environment through flooding or power outages. And this can also lead to a lot of stress and mental health concerns. So I have a few slides about how people with lung disease can think about planning ahead. Because if you haven't been impacted by a severe weather event or power outage, you probably will at some point, and it's worth thinking ahead of time about what actions you'll take and being prepared with supplies and things that you may need during that type of episode. So I got some information from this ready.gov website that you might consider checking out. They have general information about flooding, winter weather, developing a communication plan for use during emergencies, preparing an emergency kit, and tips specific for older adults. The American Lung Association also has some information, especially about power outages, because one thing that requires power, as many of you know, is oxygen equipment as well as CPAP, BiPAP. So the American Lung Association suggests creating an inventory in advance of necessities that require electricity to sustain your health or life, and that may include refrigerated medications, medical equipment, as well as thinking about whether your phone, home phone or mobile phone, will work during a power outage. And they also suggest identifying an evacuation plan in advance, including thinking about where you will go if you have to evacuate your home, And then you may also want to think about how long you can stay in the home before evacuating and keeping gas tank full, especially if severe weather is expected. They also suggest notifying your electric company, fire, and police departments ahead of time about your equipment usage that requires electricity. And they suggest to plan for a prolonged outage and evacuation, potentially identifying and registering with the community shelter that can handle your medical needs, as well as, I think I threw this in, maybe not the American Lung Association, but thinking about whether your resources will allow you to purchase a backup generator, particularly if your area has kind of an unstable power grid, which can vary a little bit across the US. So that middle bullet point I thought was interesting, and I wanted to dive a little bit deeper into the availability of shelters that can handle medical needs. I live in Nashville, so I Googled Nashville emergency shelter with oxygen concentrator. A lot of the hits were about homeless shelters, and I didn't click in detail through all of those, but they seemed a little bit irrelevant for what I was looking for. I did find a link to tn.gov, Tennessee's website, that has some information, about sheltering and evacuating, as well as, sorry, this is really small font, information about a text line that's blown up here. If you text this number with shelter and your zip code, it goes to FEMA, and they will text you back with information about emergency shelters. So I did this last week in Nashville where there was no emergency, and they told me there was no shelter within 200 miles of me. So I believe that this would be activated in the event of like a national emergency, and hopefully would work a little bit better. But I'm just saying all this to point out the idea that you can find a lot of advice, and it's not always very easy to follow. I spent about 30 minutes on Google and didn't really come up with any shelter that could provide these types of needs. So you can do all the planning in the world, but sometimes it doesn't get you very far, and I think that's where policy changes and better preparedness nationwide can hopefully help in the future. A little bit more about things that you may be better able to do in terms of maintaining access to your supplemental oxygen. If you have a portable concentrator, consider talking with your supplier ahead of time about having extra batteries and a car charger available. You could also work with your supplier to obtain tanks or cylinders that would last a considerable amount of time. And make sure you know ahead of time about how to set up and use that emergency equipment, as well as think about how long it will last given your oxygen needs. And this is just a graphic from one oxygen supply company that gives the tank size. So the tiniest cylinder that this company makes is 40 liters. And if using a conserving device on 1 liter flow, this tiny tank only lasts 2.4 hours. The biggest tank they had was 680 liters, and using it on 1 or 2 liters would get you 40 or 25 hours. But if you're on 4 or 5 liters, you're only talking about 12 or 15 hours. So all of these tanks don't really last a very long time. So it's important to think ahead of time, as I mentioned, about how long you can shelter in place before moving to someplace else that can supply your needs. And I'll just say a few things at the end here. The idea that health risks from climate change aren't uniform. As I mentioned before, certain individuals and communities may be at greater risk of harm, especially children, the elderly, people with underlying illnesses, people with poor or limited financial resources, communities of color. And then the risks probably vary regionally. So it's important to think about where you live and what extreme events you might be at risk for. I won't go through this in detail, but in general, things like extreme heat and poor air quality and dust are heavily impacted in the Southwest and Great Plains, whereas flooding and hurricanes and tornadoes are more through the northern plains, Midwest, and then pretty much all along the eastern U.S. And I got a lot of this information from the third and fourth national climate assessments, which are intended to inform Congress about policy, but I thought they provided a reasonable overview of health impacts that you may want to consider, as well as a little bit of information from the CDC. And that's my